Hello, and welcome to my discussion today about remote collaboration and evidence-based care plan. My name is Kelsey Harper, and I am a registered nurse in West Virginia. I will be the presenter for this topic. Today we will be reviewing a case study of a 70-year-old male diagnosed with COPD. We will be discussing an evidence-based care plan to improve this patient's outcome. In addition, we will be discussing evidence-based practice models that aided in making a care plan for this patient as well. We will discuss relevant sources used to cite this care plan and talk about interdisciplinary collaboration. An overview of the case study and COPD. This patient is a 70-year-old male newly diagnosed with COPD. This patient lives in a rural area and has limited access to health care, which in turn gives him limited access to specialized pulmonary care. He has a chronic cough, respiratory infections, and shortness of breath. COPD, chronic obstructive pulmonary disease, is a disease of the lungs that prevents airflow. This disease is rarely reversible and is one of the major causes of death worldwide. Smoking holds out as a main reason for the cause of COPD in America. That information was retrieved from ARGWAL 2023. It was an article that will be listed in the references. Due to the nature of this disease and the mortality rates that it holds, a multidisciplinary care regimen will be needed to help this patient. Many COPD patients face COPD exacerbations, also known as acute worsening of their condition, in which requires the patient to get further treatment and pulmonary care. That information was retrieved from Ballmeyer 2020, which will also be listed in the references. Because our patient lives in a rural area, it is very hard for him to get the treatments he needs when he does have exacerbations due to limited access to health care. In this case study, the patient's nurse, Sarah, collaborates with a team of healthcare professionals remotely, including a pulmonologist, respiratory therapist, and a pharmacist. The healthcare team works together to form a plan with the patient remotely to aid in his diagnosis. The healthcare team discusses bronchodilator therapy, including beta antagonists and inhaled corticosteroids. The respiratory therapist has been conducting remote pulmonary rehabilitation. Pharmacy has been reviewing the patient's medication list to make sure the patient is educated on how to adhere to the medication regimen. Established care plan. Reviewing the patient's case led to identification of several issues impacting the patient's outcome. To improve these outcomes, it will require a nursing care plan to be in place. The primary nursing diagnosis in this case is ineffective health management related to complex treatment regimens due to not having resources in the patient's area. Because there has been a nursing diagnosis identified, Nurse Sarah can begin to work to get this patient a proper care plan in place. Goals. Goals for this patient include those that are related to ineffective health management related to not having proper treatment in the patient's area. This will focus on short-term goals, and the patient will be given a time frame to work on this weekly. The patient will need to, 1, demonstrate the proper use of bronchotherapy and be able to use his inhalers using the teach-back method via video chat with Nurse Sarah. 2, the patient will need to meet with the pulmonologist periodically to make sure the treatments are working properly via telehealth. 3, the patient will need to meet weekly with respiratory therapists due to pulmonary rehabilitation sessions. And 4, the patient will demonstrate adherence to his medication regimen. Interventions. To achieve the above goal, the patient will need to be properly educated, as well as his family needing education on COPD and his treatments as well as medication. Due to the patient not having limited access to health care, he will need to use telehealth services to complete his appointments and treatments with specialists. Telehealth offers several benefits, services, and eases the accessibility to healthcare. It can be done over an audio phone call, video messenger, or even text. It is much more financially helpful for the patient. This information was retrieved from Desmond in 2021, which will be listed in the references. Setting up telehealth visits will improve the family and the patient education. Each visit should only involve one specialist at a time and ensure that the patient understands that and is not getting bombarded with information all at once. Nurse Sarah spoke to the rest of the healthcare team remotely, and they stated they had been conducting visits with the patient already, so this should be not be something new to the patient or his family. The patient should continue visits with respiratory therapy, his pulmonologist, and pharmacy if necessary. Evidence-based practice models. The Johns Hopkins Evidence-Based Practice Model, also known as JHEBP, was used to make this patient's care plan. This practice model exhibits a 3-step approach: practice, evidence, and translation. That was retrieved from Johns Hopkins Medicine 2023, which also be listed in the references. In the first step, it was found that COPD patients' nursing diagnosis. The second step, I researched COPD and familiarized myself with it in order to integrate a care plan. Evidence-based research related to COPD was the treatment that was conducted. In the final step, I summarized the findings to develop an evidence-based recommendation. After applying all of these steps, it was determined that more education should be given to the patient via telehealth visits as well as regular follow-ups. Relevance of the data. In order to create interventions and a care plan for the COPD patient, a review of the material and data related to COPD and telemedicine was reviewed. The sources for this project was deemed relevant by using the CRAAP method. Various scholarly peer-reviewed up-to-date articles were used throughout this process. The most useful article that I found was by the National Library of Medicine titled Chronic Obstructive Pulmonary Disease. This article met the CRAAP criteria and contained very good information on background of COPD and interventions to mold my research. Interdisciplinary collaboration. To manage any complex medical diagnoses require interdisciplinary collaboration. Telemedicine is an excellent way for the patient and their healthcare team to collaborate when they might not be able to otherwise. Various sources have promoted telehealth and telemedicine as a good technique in collaboration. With all the positives as to telemedicine, there is one negative, and that would be hands-on assessment of a patient. You lose that whenever you're doing telehealth. A patient's primary care provider is usually closer to the patient than the specialist, such as a pulmonologist. So it would be very beneficial for the specialist and the primary care providers to collaborate for the patient's well-being as well. This concludes the presentation of COPD patient and their care plan, as well as collaboration and evidence-based care planning. Thank you for joining in, and the references will be listed below. Thank you.